resources weren't as readily accessible. I never ever thought to go to an authority figure to talk about my mental health issues because no one ever did that, and it was so stigmatized.
We have the Latino community, the Asian community, largely Filipino. Of course, now the LGBT community is an emerging community in Solano County and in the Bay Area. So we have a very low penetration rate in terms of usage of mental health services.
Well, I think that the challenges that Solano County has are challenges that are in any county.
Now we have to be more in the community and be on the ground working, helping the people to survive in a very difficult environment.
Around high school, I suppressed a lot of my mental health challenges. I didn't really know what depression meant or know what PTSD meant. I just know that that's just issues you don't really talk about, especially growing in a very conservative Vietnamese community.
Based on our data, we have 8,000 medical eligible clients. Not all of them have mental health issues, obviously, but we have 200 something clients in Solano County that use mental health services right now, in the last 2-3 years. That's the data we have. So it's really very low.
In California, we have the Mental Health Services Act, which allows for communities to take stock and invest in innovative transformation of their system. And so Solano County had seen some of the work that we've done with other organizations and reached out to collaborate with us.
This is the dream of researchers like us, that the need comes from the community itself, because they have heard about the things that we have been working on with our center. They decided to call it the cultural transformation model, because what they are hoping to do is truly to transform the way in which services, specifically mental health services, are provided for these three target populations. The beauty about it is that so many stakeholders provided input, valuable input, that now it is a model of Solano County.
So to address the disparities and to improve community mental health, we need more than just a set of standards. The standards can help guide the strategies and solution, but we need an engine to power these efforts. And that engine is people.
Clients can teach us as much as we can teach them, and that we can learn from each other.
Counselors, therapists, psychologists that looked like me, even female-bodied, Asian or queer, I would feel more comfortable approaching my issues.
If you advertise a service that you can provide to the community, that doesn't guarantee, in fact, it doesn't say anything about whether or not those services are actually relevant. Part of the missing factor is trust, building trust. And what that requires is relationship. So it's about engaging with the community members, with the community-based organizations, and the county services to develop a sense of community and trust within everybody involved.
We have an outreach coordinator who's a clinician who speaks Filipino, very familiar with the culture, native speaker.
One critical piece about all of this is that the outcomes, the specific metrics that we are going to be using are not going to come from folks like me, who are academicians, and we love to look at metrics and how to measure things. But also we are going to be consulting with the communities themselves and the county and the community-based organizations as to what matters to them.
The county, I think, is moving in the right direction in terms of doing outreach and engagement and partnering with a research institution like UC Davis. We've never done that before. So this is truly an innovative project.